Hey everyone, welcome back for another deep dive. That time of year is almost here again. You feel a little sniffle coming on, maybe a scratchy throat. Is it just a cold? Could it be the flu? Or should you be masking up because it's COVID? Well, get ready to ditch the guessing games because we might be on the verge of a major testing breakthrough. We're digging into this article. Is it COVID or flu? FDA gives official authorization to test that will tell you. And it's a big deal because for the first time, the FDA has given full authorization, not just for emergency use, to a single at-home test that can tell you if you've got COVID or influenza A or B. Can you believe it? One test to rule them all. I mean, think about how much easier this could make things, especially during peak cold and flu season. No more extra trips to the doctor or agonizing over which test to take. But before we get ahead of ourselves, I want to bring in our expert to unpack this a bit. What's your take on this new development?
Yeah, it's definitely a game changer. On the surface, the convenience factor is huge, right? Faster diagnosis, potentially faster treatment. Those are major wins for everyone. But what I find really interesting is the bigger picture here. This authorization could signal a shift in how the FDA approaches at-home testing, potentially opening the door for combination tests for all sorts of things.
Now that you mention it, the article did touch on that. This could be just the tip of the iceberg. Okay, so for folks who are ready to try this new test out, it's called the Healgen Rapid Check COVID-19 Flu A and B Antigen Test. A bit of a mouthful, I know. The article said it should be available by Thanksgiving and costs somewhere between 13 and 16 bucks. But as with any test, especially at home ones, we got to talk about accuracy. What are the chances this thing might miss something?
That's the million-dollar question with any test. The FDA studies showed promising results with this one, with high accuracy rates for both positive and negative results for all three viruses. But, and this is important, false negatives are still possible. Like if you just got infected, the test might not pick it up yet. So if you've got symptoms, especially if you're at higher risk, don't just rely on a negative test. Talk to your doctor. Better safe than sorry.
Exactly. Always a good idea to get that professional opinion. Okay, but let's go back to those other at-home tests. If this one takes off, what other kinds of combination tests could we see in the future?
Oh, the possibilities are pretty much endless. Imagine testing for things like strep throat, UTIs, maybe even some STIs, all from home. This could be revolutionary for folks in rural areas, people with mobility issues, anyone who has a hard time getting to the doctor's office.
Wow, talk about bringing healthcare into the 21st century. But, and I think this is a big but, are there any potential downsides to all this at-home testing? I mean, could it lead to people freaking out unnecessarily or even misdiagnosing themselves?
Oh, absolutely. I think that's a huge concern. You can easily imagine a scenario where someone takes an at-home test, sees a positive result, and immediately jumps online, goes down a rabbit hole of worst-case scenarios when maybe they just needed some rest and fluids. There's also the issue of data privacy. What happens to all that health data from these tests? Who has access to it? These are questions we definitely need to consider as this technology evolves.
So true. It's like any new tech, right? It comes with amazing potential, but also a whole new set of challenges we need to address. So, just to recap, we've got this incredible new test that can detect COVID and the flu at the same time, a potential game changer for healthcare, but one that also brings up important questions about accuracy, over-testing, and even data privacy. A lot to think about.
It is. I'm curious to see how this all plays out. Will it lead to more proactive healthcare or more unnecessary worry? I guess only time will tell.
Well said. And that, my friends, is a perfect note to end on. Make sure to check back in with us next time when we'll dive into another hot topic shaping the future of health. Until then, stay curious.